Good evening. Today's topic of discussion is urethral injuries. If you recollect, I had done a presentation on pelvic fractures. In fact, I did two presentations on pelvic injuries. And there also we mentioned urethral injuries and to the extent of 10% of all pelvic injuries, right? Their presentation to the emergency may not be per se as urethral injuries, but they could be a part of the polytrauma patient that you normally tend to receive in the emergency departments. So I'm going back to one slide earlier that I have shown to you. And if you have seen that lecture, you would remember this particular slide. And you can see the bony outlines of pelvis. And the urethra is sitting, in close proximity in this area, in this particular area, sitting in close proximity to the symphysis pubis. And it is actually bound to that area by puboprostatic ligaments. So therefore, any kind of shearing forces that occur in this area, say in a classical pelvic fracture situation, either because of lateral compression or because of a fall, it is likely to be subject to trauma. And we'll discuss those different types of traumatic injuries that can occur. Of course, presenting purely to the emergency department may be only 1%, but the accompaniment is there up to almost 10%. And this process of urethral injury is most often associated with severe trauma, that is, say, the pelvic injuries, and it can be with childbirth, which again, you can easily imagine, and an improper catheterization, and this is the sad part, improper catheterization and the urethral instrumentation, or even a TUR, for example, can give rise to injuries followed by fibrosis and stricture. In addition to these three very important things, like here, I have just underlined these, right? In addition to these three important things, you have other issues also, like penile fracture, then foreign bodies. It can happen in psychological situation, or in case of self-mutation. Then also mutilation. Then also you can have accompanying urethral injuries. So in other words, the number of cases presenting to you, either in the emergency department or in the polytrauma situation, may not be great. But at the same time, attention is demanded urgently by this particular injury because the bladder will enlarge and start producing back pressure effects on the ureter and the kidneys. So therefore, recognition of a urethral injury is very important. So the topic of today's lecture will identify those factors only. Let us look at that. Now, before I go into the details of the subject, we should know something about urethral anatomy. I have put up a slide out here which indicates the urethral anatomy, because particularly surgical postgraduates may not be fully aware of this particular region. Now, here we have everything is already written on the slides. I may not have to use my pen. You have the bladder and the urethra going out from the bladder. It passes through the prostate, passes through the substance of the prostate, but mostly to the front rather than to the back. Then it comes out and has membranous urethra. That means it goes through the urogenital diaphragm, also called the deep perineal membrane at one time. It passes through that part. That part is called membranous urethra. And then it is surrounded by the external urethral sphincter in that particular area. And then it pierces the bulb. This is the area of the bulb of the urethra. And it pierces the bulb and then travels through the corpus spongiosum and travels through the corpus corpora on going up to the glans penis, right? So this is the corpus cavernosum, and this is the corpus spongiosum in the center, and either side is the corpora cavernosa. Now the urethra is therefore named accordingly, right? What are the different names? This part which is going through the prostate is called prostatic urethra. The one that is going through urogenital diaphragm is called the membranous urethra. And the one that is going through the bulb of the penis, That's called the bulbar urethra. And further anteriorly, it is called the penile urethra. Many people tend to call it as pendulous urethra. Whatever it is, these are the various regions or various parts of the urethra. And at some point, all of them can undergo injury. I've already explained to you, for example, if I draw, let us say, symphysis pubis out here, and the bladder is going out like this, and the urethra is going in close proximity, and this is bound out here by the puboprostatic ligaments. So supposing in case of pelvic fracture, these ligaments get torn, then the urethra is subjected to intense pressure, intense forces, let's call it as forces, the shearing forces. And that can give rise to injury to this part of the urethra, the so-called prostatomembranous urethra. It's also called prostatomembranous urethra. I'll show you another slide talking about the different parts. It's also called the prostatic membranous urethra. Further down the line, if you have a typical straddle injury, picture if you remember in the textbook of surgery of Bailey and Love, if you have a typical straddle injury, that is more likely to injure the bulbar and the penile urethra, also called the anterior urethra. So in other words, the area that is behind the bulbar urethra is the posterior urethra, and the area that is ahead of the urogenital diaphragm is the anterior urethra, posterior and anterior. So if you were to draw this thing starting out here and going till here will be the posterior urethra, and starting from here and going till here will be the anterior urethra. So just remember this. Not much is required to remember this. Now, keeping that anatomy in mind, what are the types of urethral injury that you can have? This is also called Goldman's classification of urethral injuries. Supposing it so happens during the trauma that the posterior urethra is stretched, but it is intact. Look at this picture here. It is stretched but intact. That is type 1. And if pure posterior urethral injury with a tear of the membranous urethra above the urogenital diaphragm, partial or complete, that is type 2. I've just shown you posterior urethra has got two components, isn't it? Prostatic urethra and membranous urethra. So if you have injury in that particular area, only in that particular area, and that is above the urogenital diaphragm, then that is called type 2 injury. And this is the classical injury that takes place in association with the pelvic fractures. And if you have both combined anterior and posterior urethral injury with involvement of the urogenital diaphragm, again either partial or complete, that is called type 3 injury. Now, what is type 4? If suppose you have an injury of the bladder neck, and that is also communicating here in this situation, injury of the bladder neck, and that is also communicating with the prostatic urethra, like you are having in this situation, then that is type 4. But if you have an injury of the base of the bladder without any kind of periurethral extravasation, it's called type 4A. And pure injury of the anterior urethra is either partial or complete, is called type 5. So broadly speaking, let us remember the broad headings at least. The broad headings is, if you have a straddle injury, which we often used to hear earlier, that is a type 5 injury of the urethra as per this classification. If you have a classical pelvic fracture injury, where the tear occurs both in the posterior urethra, that is type 2. So this is the broad fact. If you have posterior urethral injury, say pelvic fracture, that is type 2. And if you have the typical straddle injury, that is type 5. It's not very difficult. It looks complex, but it is not. If you remember the anatomy of the urethra, then in that case, these injuries are quite easy to remember. The different types of urethral. Why are they important? You will see it. when we go into the management part.